hand hygiene, I'm going to respect the patient's privacy, so I am going to draw any curtains or close any doors if needed. And now I'm going to talk to my patient. Good day, Ms. Percival.
Good day.
Yes, I am Nurse Rae-Yanne, and I am here to perform a head-to-toe assessment on you today. Before I proceed, could you verify your name and your date of birth for me, please?
Proceed further, October 2nd, 1973.
Okay, thank you. Now, for the head-to-toe assessment, it entails a lot of movement, so you have to stand up, sit down, and lay down. So, is it okay if I allow it? Well, is it okay if I perform the head-to-toe assessment on you today?
Yes.
Okay, and in addition, collect personal information?
Yes.
Okay, so now that I have the patient's confirmation, I am going to gather up all my equipment. So I have all of it placed here. Okay. Okay, so I have all my equipment. Now I am going to assess the patient's mental status. As you can see, the patient is dressed appropriately for her age and for the weather. She is well groomed, okay, and she looks oriented based on how, when I was talking to her, she's oriented. Okay, so now to further assess the orientation, I'm going to ask the patient a few questions. Okay, so Miss Percival, can you tell me your first and last name again?
Proceed further.
Okay, and could you tell me what day it is?
Today is Thursday.
Okay, and could you tell me where you are?
I'm at my house.
Okay, and what are you doing today?
Well, I'm doing a health assessment, a head-to-toe assessment.
Okay, so she's oriented times 4. Now we're going to check for her cognition and her intellectual state. So I'm going to ask her a question and she's going to tell me, well, explain to me what the question is, okay? So Miss Percival, can you tell me what this head-to-toe assessment entails?
Well, it's going to examine my entire body, and I'm supposed to stand and sit, and I would have to lay down and move on in different directions from one side to the next.
Okay, thank you. So the patient's mental status is intact, okay? So next we're going to move to the integument part of it. So I'm going to assess the patient's skin. So first I'm going to check the radial pulses bilaterally, okay, and it's +2. Then I want to check the skin turgor. So I'm going to pull up the patient's skin, okay, and that's the dorsal part of the hand, okay, and then it went down one time. Okay, this can also be done on the clavicle right here. Okay, so now I'm going to check the patient's temperature with the dorsal part of my palm, my hand. So the patient's skin is dry, is warm, sorry, and then you look at the patient's skin, it is dry, no lesions, and then we're going to look at the pulse points as well. So the pulse points, no edema is noted, and no lesions, no redness. Okay, so next we're going to check for the capillary refill. So I'm going to press down on the capillary bed, and it should come back, the blood should come back between 1 to 3 seconds. Okay, and you do that with each finger. Okay, so the integument part is intact, she is good. Okay, so now I am going to inspect, palpate inspect and palpate, sorry, the head and the neck. Okay, so first I'm going to do the head, and for this part you want to put gloves. Okay, so what you're going to do when you're inspecting the head, you want to observe any lesions, any lumps, okay, and you want to just check for any abnormal findings. Okay, so it's good. Then you want to throw your gloves and then perform hand hygiene. Okay, and then you continue the assessment. So now I'm going to assess for cranial nerve number 7, which is the facial nerve. So I'm going to ask the patient to perform different exercises with the face to see if that nerve is intact. So Miss Prevost, can you please close your eyes as tightly as you can? Okay. Can you lift up your eyebrows? Okay. Can you puff up your cheeks? Okay. Can you frown? Okay, using your mouth. Okay, and then can you smile? Okay, so cranial nerve number 7, which is the facial nerve, is intact. Now I am going to assess cranial nerve number 5, which is the trigeminal nerve, and that nerve is sensory and motor. So I'm going to take my paper clip, and I would have the patient close her eyes. So could you close your eyes for me? And you're gonna tell me for the sensory part, you're gonna tell me if you feel if it's sharp or dull, okay?
Okay. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull.
Okay, so that nerve is intact. Now I think for the first one, I didn't do it hard enough, so she said it was dull. Okay, so that's the sensory part of the trigeminal nerve. Now for the motor part, I'm going to put my hand on the mesentery and the temporal muscles. Okay, and then I'll have the patient open her mouth. Okay, close your mouth and then clench your teeth. Okay, so that nerve is intact. Okay, so now I am going to assess the patient's eyes. So first I am going to look at the eyes, and it is midline. Well, it is in place, in line, and it's the pupils are equal. So now I am going to have the patient, so could you put your pupils up, your eyes up, and I'm going to look at the sclera and the conjunctiva, and it is white, which is normal. Now you want to put gloves for this part because I'm going to look at the acromial apparatus, which is under the eyes. Okay, so could you tell me if you feel any discomfort?
No.
Okay, so you just palpate it slightly, and then you look to see if you see any drainage or any you feel any edema. Okay, so she said she doesn't feel any discomfort, so it's intact. Okay, so now I'm going to take my pen light. Okay, and I am going to do the direct and indirect pupils to see if they constrict. Okay, so for the direct, you want to take the pen light and just put it from the side going into the pupils. Okay, and then you should see that the pupil, it constricts. Now for the indirect concentrial, you want to look to see if the other one constricts. Okay, so it's intact, and then now you go on to the other one, the other eye, the other pupil. Okay, and as you put the pen light, it constricts, and that's the direct, and for the indirect, you can see that the other pupil it constricts as well. Okay, so the indirect and direct, the for the pupils to constrict, it is intact. Now I am going to do accommodation. So for accommodation, I am going to have her look up at a far away object, and the pupil should be dilated. When she comes back to the pen light, I'll tell her to come back to the pen light, and her eyes should constrict. Okay, so could you just look up at a far away object?
What do you want me to look at? The hat?
Just, yes.
Okay.
Okay, so she's looking at the hat, so her eyes are dilated, and then could you look back at the pen light? Okay, so it constricts. Now, before you wanted to start the eyes, I forgot to mention that to test for cranial nerve number 2, which is the optic, you will use the Snell chart. Now, since I don't have a Snell's chart, let's just assume that before the head-to-toe assessment, she did do a Snell's chart and she had 20/20 vision. So that will mean that the cranial nerve 2, which is the optic nerve, is intact. Okay, so now we're carrying on. Now we're going to test for cranial nerves number 3, 4, and 6, which is the oculomotor, the trochlea, and the abducens. So that's a 6 points of gaze. So for the 6 points of gaze, I don't want you to move your head, but I would like for you to move your eyes into the direction of the pen light. Okay? Okay? Okay, so the pen light, and then you move. No, not your head. Okay, so those nerves are intact. Cranial nerves number 3, 4, and 6. Now for convergence, I am going to have the pen light. I'm going to ask you to move your eyes towards the pen light, and I'm going to bring it to her nose and back up. Okay, so 1, 2, 3, go. Okay, so it's intact. Okay, so now that we are done with the eyes, I can put away the pen light for now. Okay, and I am going to do the ears now. So first you want to look at the ears. It's symmetric, so it's good, intact. It doesn't have any redness, any edema seen. So now I'm going to palpate, and when I palpate, could you tell me if you see any, but if you feel any discomfort? Okay, so we're going to go the auricles, the lobes, the tragus. Okay, and for the tragus, if she did say that she was feeling any discomfort, that could be a sign of an ear infection. Okay, so no discomfort was felt?
No.
Okay. So now I'm going to take the pen light again, and I am going to look at the internal part of the ear. So I'm looking at it. Okay, and then you note any sebum, any drainage, any redness, or any edema. Okay, so I'm going to look, and none of that is noted, and I'm going to do that on the opposite side as well. Okay, none is noted, and she didn't complain of any discomfort. Okay, for this one as well, you have different tests to do. So I'm going to do a whisper test, then a Weber test, followed by a Rae-Yanne test. Now those assess for cranial nerve number 8, which is the vestibulocochlear nerve. Okay, so for the whisper test first, I'm going to ask you to hold hold your hand to your right ear, and I'm going to whisper a word, and then you tell me, repeat the word I said. Okay?
Basketball.
Okay, and then could you occlude the other F for me?
Baseball.
Okay, so this nerve is intact. Now for the Weber test, I'm going to strike the tuning fork once and I'm going to place it on top of her head. Okay, so when I do that, could you tell me when, so you're supposed to hear a sound and you tell me when it stops, okay? Okay, and then that was the Weber test. Now for the Rae-Yanne test, I'm going to put it on the mastoid process first, and that's the bone conduction. Okay, and then I'll place it in front of the ear. Okay, so air conduction is twice as long as bone conduction. Now, if you're not able to see it there, the mastoid process is right here, and then you placed it in front of the ear. Okay, so those this cranial nerve number 8 is intact, which is the vestibulocochlear nerve. Okay, so now I am going to inspect the nose. So first you just inspect it. The nose is midline. Okay, now no edema, no drainage, no lesions. Okay, no redness. Then I'm going to palpate it. Okay, and I'm going, while I palpate the external part of the nose, could you tell me if you feel any discharge?
Discomfort? No.
Discomfort, sorry. Okay, and then I am going to palpate the sinuses as well. So you have the maxillary, and then do you feel any discomfort?
No.
Okay, and then the frontal?
No.
Okay, so it's good externally. So the internal part now, you want to use your pen light and you look inside of the nose. Okay, the septum is not deviated. There is no discharge noted. Okay, no lesions, no edema, no redness. So that's good. Okay, and then now I am going to assess cranial nerve number 1, which is the olfactory. So I'll have you close your eyes for me, please. Okay, and I'm going to place something in front of you, and could you tell me what is it you're smelling?
Oh, smells like coffee to me.
Okay, so yes, she's right. So the cranial nerve number 1, with the olfactory, is intact. Okay, now I'm going to assess the lips. Okay, so the lips, they look pink. Okay, they're not dry, they're moist. Now, if the lips were blue, that would mean that could be a sign of cyanosis. Okay, not enough oxygen in the blood. Okay, if the lips were dry or had any lesions, that could be a sign of dehydration. Okay, so her lips are intact, so we'll continue. Now I'm going to take the my tongue blade. I'm going to open it. Now for the mouth, you'd want to have you'd want to use a mask and gloves in an event that the patient coughs or any sputum or anything, discharge comes out. Okay, so now I'm going to have the patient open her mouth, and I'm going to assess the buccal mucosa and the gums. Okay, so you look on either side. Okay, so it's nice and pink and moist. Then you look at the teeth to see if you have any decay or any cavities. The number of teeth as well, you would note it. So it's good. Okay, then you want to assess the tongue. So could you open it? Yes, could you stick out your tongue for me? And then the tongue is moist and it's pink. Now if it was black, that would be like a fungal infection, or if it was dry and it had cracks in between, that would mean that the patient is dehydrated. Okay, so now I am going to test for cranial nerve number 10, which is the vagus. No, sorry, cranial nerve number 12, which is the hypoglossal. So I'm going to have her push her tongue upon resistance. So could you stick out your tongue? Stick out your tongue. Okay, and then I'm going to have her push against resistance. So when, yes, so could you push against the resistance? Okay, and then the other side. Okay, and she did that with ease, so that nerve is intact. Now I'm going to look, okay, now I'm going to look at the hard palate and the soft palate. Okay, and they are both moist and red, they are intact. Okay, and then I'm going to look at the uvula, which is testing for cranial nerve number 10, which is the vagus. So I'll have you say ah. So could you say ah for me?
Ah.
Okay, so that is intact. Now I'm going to put this down. Okay, so you dispose of it. Then I'm going to test for cranial nerve number 9 and cranial nerve number 10, which is the glossopharyngeal and the vagus. So I'll have the patient swallow, okay, and then I'm going to note if she did it with ease, if she had any discomfort. So when you swallow, tell me if you feel any pain or anything. So could you swallow for me, please? Okay, so she did that with ease and without any pain noted. Okay, so now I am going to do the neck. So with the neck, you want to look at the neck, observe any lesions or edema. Okay, so if it's symmetric in line, okay, and then I'm going to assess, palpate the lymph nodes. So I'm going to start with the occipital, which is the back. So the occipital, and then the preauricular, which is in front of the ears. Then the postauricular, which is behind the ears. Okay. Then the tonsils. Okay. And then the submandibular, the submental, the deep cervical chain, which is anterior, and then you have the posterior cervical. Okay, and then you have the supraclavicular. So I'm going to have you shrug your shoulders for me, please. Okay, so that's good. Okay. Okay, now for the mouth, I forgot to mention that you also want to look at the tonsils and just ensure that the tonsils are nice and pink. It's not inflamed or red. Okay, no edema noted. Okay, so after you do this, you want to palpate the trachea. So I'm going to palpate the trachea and I'm going to see if it's midline. Okay, any edema noted? Do you feel any discomfort when I do this, when I palpate it? No. No discomfort. Okay, so it's intact. Now I am going to palpate the thyroid gland. So could you turn to me? No, like against. Okay, so I'm going to, now there are two approaches. You have the anterior and the posterior approach. I'm going to take the posterior approach. So I'm going to have the patient, I'm going to hold the, put my hands over the thyroid. Okay, and could you bend your head for me? and turn to your right. Yes. Okay, so I didn't feel any pulsations, so that means it is intact. Okay, because with the thyroid gland you're not supposed to feel any pulsations or anything. Okay, so it's intact. Now I'm going to assess for any JVD, which is the jugular venous distension. So could you lay down for me, please? Okay, and could you turn your head to the right? Okay, so I'm going to go to the opposite side and I'm going to bend down and I'm going to look to see if I see any pulsations. Okay, and I don't see any, so that's good. Okay. Okay, now could you sit up again for me? Okay, so now I am going to auscultate for the thyroid gland and the carotid arteries for any bruits. Okay, so I'm going to have you take a breath for me, please. Okay, and then I'm going to auscultate using the bell of my stethoscope, the thyroid, the carotid arteries, okay, so no bruits are noted, no bruits. Okay, so what I'm going to do next, I'm going to palpate the carotid arteries, and I'm going to palpate them one by one. Okay, so I'm going to palpate for any thrills. Okay, no thrills. Okay, no thrills. Okay, so the neck is intact. Okay, so now I'm going to do the hands. Okay, so you assess, I'm going to palpate, check for the radial pulses bilaterally. Okay, and it's 2+. Then you want to do the capillary refill. Okay, and it is less than 2 to 3 seconds, which is good, which is normal. Okay, then you want to inspect the skin and just note any lesions. No lesions, no edema noted. Okay, so now what I'm going to do, I'm going to do the reflexes for the biceps, the triceps, and the brachioradialis. Okay, so I'm going to take my hammer for this one. Okay, now for the biceps, I'm going to put my hand here and then just once. Okay, and then you see the reflex. Then for the triceps, you're gonna have the patient relax the arm, so relax your hand. Okay, and then it's just one. Okay, and then for the brachioradialis, just once. Okay, so the reflexes are intact. Okay, so now what I'm going to do, we are going to look at the chest. Now the anterior, the posterior, and the lateral. So I'm going to start off with the posterior and the lateral. Okay, so first, and that's for lung sounds. So first, you're gonna start at the apex. If you come closer, you're not moving. Okay, so yes, so you're gonna start at the apex, and you want to assess for any firmities. Now, when I touch you, when I palpate, I would like for you to say 99. Okay, 2, 3.
99.
Okay.
99.
Okay, and then you do those sideways.
99. 99.
Okay, the intercostal spaces.
99,
Okay, and then the lateral side.
99, 99,
Okay.
99, 99.
Okay, so no firmities observed. Now, before you do the palpation, you want to inspect and see the patient's back is symmetric. You have no shoulders going up, one shoulder going higher than the other. Okay, now if any shoulder was going higher than the other, that will suggest scoliosis. Okay, now I am going to, sorry, before that I'm going to percuss. So what I'm going to do, I'm going to put my hand starting on the apex, going down, and I'm going to do it 3 times on each. Okay, and it was good. Now I am going to auscultate using the diaphragm of my stethoscope. Now I'm going to start on the apex, and I would like for you to breathe on each one. Okay. Okay, and that was the lateral sides. Okay, so no wheezing was noted or any abnormal sounds. Now, if any wheezing was noted, that could be a sign of pneumonia. Okay, so now that I have done the posterior side, now is the lateral side. Okay, so for the lateral side, you want to inspect.
Yes,
So yes, the sorry, not the lateral, the anterior side. You want to inspect it. So could you lay down for me now? Okay, and while you're just inspecting, you are going to look to see if her accessory muscles are being used while she's breathing, the rhythm of her breath sounds, and all of that. Okay, so now I am going to palpate starting from the apex. So I'm going to palpate, and that's on top of the clavicle. You can come closer. Okay, so then we palpate, and then you palpate the second intercostal space. Okay, and we palpate to hear if we hear any firmities. Okay, so no firmities are heard. Now I am going to percuss. Okay, so it's intact. Now I'm going to auscultate. Okay, so I'm going to auscultate using the bell. And I'm going to have you breathe. Okay, so no abnormal sounds were heard or no wheezing. Okay, So now I am going to check the heart. So what I'm going to do, I am going to first so what I'm going to do, I'm going to auscultate the heart. Now before you auscultate, I'm going to look for the apical pulse. I'm going to check it for a full minute. Okay, so, and that's the 5th intercostal space, okay, on the left. So you're gonna check it for a full minute, okay, and then you're just listening for the lub-dub sound, okay. So after checking for the full minute, now you're going to now I am going to auscultate. Now I'm going to auscultate starting from the pulmonic, the aortic. So the aortic is the 2nd intercostal space, okay, from the midline, the mid-clavicular line. And then you have the pulmonic, which is the 2nd intercostal space to your left, okay. And then you have the herbs, which is the 3rd intercostal space, okay. Then you have the 4th, which is the triceps, and then the 5th, which is the mitral. Okay, so they are intact and it's not abnormal. Okay, no abnormal sounds are being heard. Now I am going to look at the abdomen. So for the abdomen, you want to inspect, then you want to auscultate, then percuss, and then palpate. Now the reason why you want to auscultate before you palpate is because when you palpate, you hear bowel sounds, you hear irregular sounds. So you'll auscultate first, and then so you don't hear any bowel sounds, okay? So first you're going to inspect the abdomen. You go midline, and that the stomach is symmetric, okay? Everything is normal. And the color, you want to note if any discoloration or anything like that, okay? So it's the same color. Now you want to you're going to auscultate. So I'm going to start from the left lower quadrant, the right lower quadrant, sorry. Okay, and then you want to listen to see if you hear any swishing sounds. Okay, the right upper quadrant, the left upper quadrant, and the left lower quadrant. You also want to auscultate the spleen and the liver. Okay, so no abnormal sounds, no swooshing. Okay, so now we are going to percuss. Okay, and can you tell me if you feel any discomfort?
No.
Okay, so no discomfort was noted. Also the liver, the spleen and the liver. Okay, so now what I'm going to do, I'm going to do light palpations. Okay, so could you tell me if you feel any discomfort? That was the right lower, the right upper, then the left upper. Now the left lower quadrant. Okay, and no discomfort was noted. Okay, so now what I'm going to do, I'm going to look at the legs right now. No edema noted. You also want to check the temperature. So with the dorsal part of your your hand and the temperature is warm. Okay, no lesions noted, no discoloration. So now I'm going to palpate. Okay, and while I palpate, can you tell me if you feel any discomfort?
No.
Okay, so no discomfort noted. Okay, so now I am going to do the dorsalis pedis and then the tibial pulse, the pulses. Okay, so the posterior tibial pulse and then the dorsalis pedis pulse. Okay, so this one's going to be bilateral. Okay, and it's 2+. Now I'm going to do the tibial pulse, the posterior tibial pulse. Okay, and that's 2+. Okay, now I am going to assess the muscle strength. So I'm going to, for the flexion of the dorsalis of the feet. So I'm going to ask you, so could you bring up your feet up on resistance? Bring your feet up on resistance. Okay, so she did that with ease. And then the dorsiflexion. So I'm going to have it here and then you're going to press down. Okay, so that's intact. Now I'm going to use the hammer to do the reflexes. Okay, so I'm going to do the patellar reflex and I'm going to do the Achilles reflex. Okay, so could you sit down for this one, please, Miss Sprayville? Could you sit down for me, please? Okay, and I'm going to assess first the patella, and you only do it once. Okay, for the reflexes. Okay, and I'm going to do the Achilles, which is behind the ankle, the ankles, on top of the ankle. So 2, 3, go. Okay, so now I'm going to have you lay down again for me. Okay, and while she's laying down, I'd like for you to turn your side, and that's assessing the sacrum, the sacral. Okay, the sacral for sacral edema. Okay, so I am going to look at it and I'm going to palpate it, and please tell me if you feel any tenderness. No tenderness?
No.
Okay, so no tenderness noted and no edema, which is good. Okay, so now could you stand up? And I am going to perform the Romberg test. Okay, so what I'm going to have you do, could you close your eyes for me? And could you put out your hand? Okay, on the side. Okay, and she's going to do that. If she can do this for 20 seconds without swaying or being out of balance, that means she's negative for the Romberg test. And if she sways or slants, like she's having difficulty keeping it, that means that she is positive. Okay, okay, stop. Okay, and then I'm going to have her walk towards me from the heel to the toes, heel to the feet, heel to toe. Okay, and then I'm going to have you walk back with just normal.
Backward?
Yes, just walk. Yeah, you can turn and walk. Okay, and she did that with ease, so those are intact. Thank you. Now that's the end of our head to toe assessment. I'm going to perform hand hygiene, and yes, that's it. Thank you. Okay, so whilst performing the head to toe assessment, I forgot a few parts. So for the JVD, the jugular venous distension, you want to make sure that when the patient is lying down, that they are lying down at a 30 to 45 degree angle. Okay, and then for the cranial nerve number 11, which is the spinal accessory, you want to ask the patient to shrug her shoulders against resistance. So could you shrug your shoulders against my resistance? Okay, and she did that with ease. Okay, also for the heart, you want to make sure that you when you're auscultating, you use the diaphragm and the bell. Okay, so I'm going to do it one more time. Okay, so you start from the aortic, which is the second intercostal space from the midclavicular line. Then the pulmonic, which is the left side of the second intercostal space. Then the herbs, which is the third. Okay, and then you have the tricuspid and the mitral. Okay, that's the diaphragm, and then with the bell, you want to do the same thing, and you're listening for the heart sound, the lub-dub. Okay, so that was the aortic, the pulmonic, now the herbs, then the tricuspid, and then the mitral. Okay, which was the herbs was the third intercostal space, the tricuspid was the fourth intercostal space to the right, and the mitral was the fifth intercostal space to the left, sorry. Okay.